When caring for a patient with a chest tube, it is important to understand certain aspects of the care. Many times, questions arise surrounding certain topics. Is it appropriate to allow ambulation while a chest tube is in place? As the patient nears the end of treatment, what are the nurse's responsibilities? What orders or changes to the chest tube should the nurse expect to see? Once the chest tube is removed, what must be done to ensure the patient's health and safety? In this video, these frequently asked questions will be addressed in an attempt to help the nurse confidently and safely care for patients with chest tubes. Just because a patient has a chest tube doesn't necessarily mean they have to stay in bed. Check the orders on that patient. They may have an order for ambulation. If they don't, and the patient wants to ambulate, contact the physician and find out if it is appropriate for this patient. Some patients will be able to ambulate in the hall. This is only for patients that can be disconnected from suction for periods of time. It will not be appropriate for all chest tube patients. For these patients, simply disconnect the suction. They can now ambulate in the hallway, but they will need to carry the Oasis system with them. You do not disconnect the system from the patient. Some patients will be able to ambulate, but will need to stay connected to suction. These patients won't be able to walk in the hallway, but could ambulate in the room. You can connect suction tubing extensions to the Oasis unit to allow the patient to move more freely within the room. They will need to carry the Oasis unit with them, as it will still be connected to the patient. When patients are ambulating with their Oasis unit, be sure to check the canister regularly. If there is evidence that it was accidentally tipped, it will need to be replaced. For those patients ambulating while still on suction, ensure the bellows are appropriately extended. If the extension tubing gets kinked or knotted, it will not be able to maintain the proper suction on the patient. Chest tubes will eventually be removed after the course of treatment has completed. The nurse should know how to care for the patient post-chest tube as well. Sometimes, after the chest tube has been in place and there is no evidence of bubbling or new drainage, the physician will exchange the Oasis system for a JP drain attached to the end of the chest tube. This is to make sure that there is no air or fluid leaking into the pleural space. If the JP drain remains compressed, the chest is healed. If the JP expands with either air or fluid, the Oasis will likely be reattached to the patient until they can fully heal. Another option that is sometimes used to assess if the chest tube is still needed is to clamp the tube for a period of time and obtain a chest x-ray to look for any evidence of pneumothorax or fluid in the pleural space. If the x-ray comes back clear, the chest tube can be removed. If not, the Oasis system will likely be reattached. When it is appropriate, the chest tube will be removed, most likely by the physician or by Holly Favero, the NP that oversees chest tube cases at St. Mary Mercy Hospital. A dressing will be applied similar to the dressing that was discussed earlier in this video. Petroleum gauze will be placed over the site and a sheet of tape and 4x4s will be adhered to all four sides around the petroleum gauze. This dressing will remain in place for 48 hours after the tube is removed. For 30 minutes after removal, the patient has to remain in bed. For 6 hours after removal, the patient must avoid any twisting motion with their body. If they turn their body, they have to turn their entire body from the hips up as one unit, not twisting their torso. If they twist from the torso, this will likely reopen the site and cause their lung to drop, leading to the placement of a new chest tube to treat the new pneumothorax, and the patient is back to square one.